Eric Hammer here, registered physiotherapist. Today, I'd like to talk to you about the impact of the shoulder blade or the scapula and its ability to move in this upward rotation in order to regain shoulder flexion or elevation. But before I begin, please hit that subscribe button below to get notified about any new videos I have on my channel here. So essentially, when we're rehabbing the shoulder, right, particularly with limitations of overhead movement, so shoulder flexion here, the shoulder flexion movement, it doesn't just take place at the glenohumeral joint, so basically where the head of the humerus attaches onto the shoulder blade. There's other components in the body that will, depending on its movement, will be able to maximize our ability to extend the arms up. One of those things is the ability of the scapula or the shoulder blade to do an upward rotation. So essentially what that means is the ability of the lower component of the shoulder blade to go up in this direction. That's a lateral rotation of the scapula. So basically, if we're looking at the right side here, it's the ability, right, of this here to come up as I'm raising my arm. So there's a number of different muscles that will either help to improve our ability to do that, or will do the opposite when it's activated and downwardly rotate. So essentially what we want to do when rehabbing, if this is a limitation, is we want to look at, are the muscles that do the opposite, that do the downward rotation, and those muscles would be your lats, okay, so your lats, your rhomboids, which are muscles in the back of the shoulder blade. Pec minor will also limit that. And your levator scapula, which is a muscle just in the back here that when it's tight, it will actually prevent, in a lot of cases, this upward rotation will do the opposite. It will bias downward. So we want to make sure that those particular muscles are lengthened to some degree, right? That they're not in a shortened position and they are not creating any sort of limitations in the ability to do the upward rotation. And then the muscles that actually engage in upward rotation, well, we want to try and fire them and get them stronger. So that would be your serratus anterior, that would be your lower and upper traps. And so again, with those, we actually want to do exercises to strengthen those muscles in order to improve the ability to do that lateral rotation and to ideally get those last few degrees of shoulder flexion. So today I just wanted to go through a couple exercises that can be helpful in terms of regaining that mobility. So the first one I want to go through is actually a stretch for the lats, right? So again, when that's really tight, it will prevent our ability, right, to go into this lateral rotation when that muscle is shortened. So we actually want to work on increasing and lengthening that. So a great little exercise for that is you go up against the wall. Okay, you're going to try and keep your back flat. And then the idea is you're actually going to try to bring your fingertips to the back of the wall here. You want to keep your elbows in nice and close and parallel. And then you actually want to try and bring your hands up while you're maintaining that parallel position. As you can see here, I'm starting to struggle a little bit because I'm quite tight through there. So the idea again is you're trying to keep those elbows parallel. So if they start coming up like this, you know you've lost it. Okay, so that's that would be a great stretch to do. Another one is actually a self mobilization of the scapula or the shoulder blade into lateral rotation. And so the way that this would work is you can actually take, I've just got a foam roller here, okay? So I'm going to show this up against the wall, but I basically place my arm on the foam roller, okay? And then you grab onto the outer part of your shoulder blade here with your opposite hand, and basically what I'm trying to do is I'm trying to push the shoulder blade again up and laterally with my hand, so if you can grip onto the end point, and then while I'm doing that, I'm actually gently pushing against the foam roller to do a little posterior glide on the shoulder head of the humerus while I'm raising up my arm. So again, we're trying to facilitate lateral rotation on the outer part of the scapula. So those are a few to do to, again, work more so on the lengthening component and mobilization of the scapula. Now, in terms of from a strengthening standpoint, what you can do is actually, it's basically a shoulder press type position. And this is gonna help, again, with the lateral rotation type movement. And also, it should help to facilitate a contraction of the serratus anterior muscle, which will again help to facilitate lateral rotation of the scapula. So I've just got a TheraTube here, right? So the idea would be you step on the tube, okay, arms here, and I'm going to facilitate this shoulder press type position. And you can actually do, like if you've got a larger tube, you would do that on both sides at the same time. Okay. Other exercises that would help with that as well is it's called a PNF pattern, where basically I'm going into a rotation type position, right, with the TheraBand. That can also help in terms of, again, rotational movements, along with what we showed you before, which was the shoulder press type exercise. Please feel free to leave a comment below if you have any specific questions or concerns. And make sure to check with a physiotherapist to make sure that this is an appropriate exercise for you. And thanks again for watching, and have a great day.